Hello everyone, my name is Razia. I'm back with another video. I hope whoever is watching this, um, I'm glad that I'm doing what I want to do, and I really hope this video is helping you. Um, I am not satisfied with the view count or the amount of response I get from the audience who watching this. But trust me, I really love what I'm doing, and I hope anyone who watches this is really finding these videos useful. So, before anything else, with that being on the mind, let's move forward with our today's episode, and this is PCP. Oh my god, this cursor is bad. I use this, okay? I'm using my hand literally, but anything that's being of use, I'm happy to do. So this is PCP, okay? PCP. So this patient was HIV positive, very young patient, 40 years old. And she also had candida in the vulvovaginal area. Okay, she came in with chest pain, sputum, dry cough, as well as a shortness of breath. So you all must be having an idea by now on what to order. I am going over relevant and most um, forgetful orders just so you can remember through my video lectures I'm posting here. So one of the most important orders um, in response to this particular case is gonna be LDH. Why LDH? Because this is going to be some or the other way into a diagnostic criteria. If it is very high, that would indicate patient is progressing, and literally it's gonna be a very poor prognosis. Okay, so it's really bad sign. Okay, so we want to get this right away to identify where the patient is, to get a clue on the situation. The next thing I would want you guys to order in is gonna be pulse oximetry. So again, for chest pain and for lung pathologies, pulse oximetry is very important, guys. Do not miss out on simple details. Pulse oximetry can come out very low. In this patient, it was less than 85. So you gave oxygen, you got the points. You're almost towards the betterment of this patient's treatment. All right. So if the patient has very low oxygen levels, you will give the oxygen. At the same time, you want to do ABG analysis. There are two important cases where ABG analysis kicks in. Other one I could remember is COPD. Okay. So because of the vulvovaginitis, all we are going to do here is the microscopic vaginal fluid exam. You can otherwise see as KOH preparation. So this can be a bit tricky to pull out from the order list. This is microvaginal fluid. You can simply type vaginal fluid, I guess, and the order should just pop out. All right. So this is very important test. This will guide you towards the diagnosis, that is candida. although in the vignette it says why discharge, we still want to go ahead with this to confirm our diagnosis. Okay. And then when we see a sick patient in general, always make sure to start your orders with the saline infusions. Okay. So this is like the general aspect to any patient. We will start with saline infusions, especially if brought in sick and diseased individuals. Um, so next one that you want to think of is do hepatitis panel. Now, any time if you see a sexually active patient, you have to always do a hepatitis profile. Okay, you should have this in your mind, as in on tip of your tongue, to do HIV, hepatitis, syphilis, gonorrhea, chlamydia, as well as other STDs, to rule out certain other concomitant infections. Finally, you might want to do blood cultures. Okay, blood cultures for pneumonia patients with um, infectious pathologies, order blood cultures. So this is about the orders. If you have these particular orders in place, you are almost done. And let's go back. Let's go to next half of the video session that I'm going to talk about. And this is going to be treatment of cause. So firstly, what is the treatment? We all know if the patient has uncontrolled HIV viral load, there is candida infection. So let's treat this one. This one is nystatin. Go with topical nystatin. This is more than enough. Now, if there is a drug resistance, or if there has been a previous episode and there has been resistance or something, in that case, you may want to go with oral fluconazole. Okay, so bear in mind that this is going to be a second line agent for vulvovaginitis. Okay, so next we have to kicked in one component. We are yet to knock out the main pathology, that is PCP. So for the PCP, we have to give TMP SMX. Now, if at all there is sulfur allergy in this patient, then you may want to avoid this. So what is the alternative drug that you may want to give? Do you want to guess? All right, I'm going to say it out loud. It's going to be IV pentamidine. We need to know the alternatives in order to prescribe the drugs. Suppose now in pentamidine, is something that has to be given IV. Okay, let's do it. Pentamidine. This is like a very age-old drug. It's traditionally being used. This is a very good alternative to remember it at this time, especially if we are doing one particular case. I like to talk about every point, so just so we hit at the right spot. I don't want to miss out. And so I am trying hard to keep you guys updated with what I have been learning. And then that's it. You just have to um, do some final touches in the preventive care. Maybe refer the patient to the public health. Do not forget this public health department, because HIV is a notifiable pathology. Okay, public health department should come into the scenario. Finally, there can be certain bad habits. If at all they have mentioned this in your vignette on the exam day, make sure you address that. Take the opportunity to complete the case as better as possible. Now, if the patient has been smoking, we definitely want the patient to cut back on smoking, because this is something that they can do from their side. And we want that. Smoking is a big no. Let them know about it. Do not miss out on these important details. All right. That brings us to the end of the video. I hope you like it. And thank you for watching.